One of our great patients, Jesse Kerr. He was here, when did you start? Maybe 2 months ago?
2 months, 3 months ago.
Okay, with some low back pain. He's a young guy. As you can see, he's a power lifter. He goes to school over at Coastal Carolina.
Coastal Carolina, yes sir.
All right, big fan. And we're trying to keep him in the weight room, keep on doing his lifts without his back pain worrying him. Have you responded pretty well so far?
I've gotten better. I've tried everything, physical therapy. I've gone to 2 specialists. I've been everywhere. And then I came here, as I guess the last resort.
Yeah, that's what a lot of people do.
And honestly, the stuff before, it helped me a little bit, and I felt better, and then I went back to the gym. I'd be injured the next day here. I got better within a month.
Cool, good stuff. So what we're going to do today, I'm just going to give him a general adjustment. He's not feeling a lot of back pain, which is great, but we're going to keep it that way. So first, let's go on your back for me. So this back.
Oh,
there you go. All right, so what I do first, especially with our guys that train all the time, we want to stretch his leg muscles out and make sure that they're all nice and balanced. So I just go through some general hip and low back stretches. Jesse's in really good shape, so he's pretty flexible, so I can see that he does what we tell him. So one of the things that I tell all my young athletes, or really my old athletes, kind of skate by there, I'm the guy with all my patients. I'll keep you in the weight room. I'll keep you on the mat with all of our jiu-jitsu guys and judo guys. I know when you go to a lot of doctors, they'll say, hey, just stop it. I understand the mentality. I'm there. I have that same mindset. So we'll do our best to keep you on the mat or keep you in the weight room as long as you can. This is also easier for you to get to it.
Oh, yeah.
It's got to be like 20 minutes closer.
Oh, yeah.
Right?
It's like 20 minutes. Yeah, it's awesome. I drove straight from campus today. It took like 10 minutes.
Nice. So, look, if I had to be critical with you, Jess, stretch your hamstrings a little more.
Yeah,
okay. I mean, everything's good
with my hamstrings.
With your hamstrings. And when they're good for anyone else, but for your age,
they could be better.
They could be better. Right, come on up. Let's go back on your stomach. So the next thing I do with a lot of my patients with low back pain, we want to loosen up these lumbar paraspinals, and especially down here, L5, S1, that's where most people hold their pain. What I just do is a little bit of pressure. I'm using my thumb on there. And we're just kind of stretching those muscles out. And what I want is for his leg to come all the way down pretty easily or without any tension. And there's a little bit there. When's the last time you did squats?
It was Thursday.
Okay. So not too bad?
Nope, not bad at all.
Can I check those things without bringing too much lead in? All right, so next thing I'm doing, I'm going to use a handheld instrument. So this is a Pro Adjuster, I think the brand name is. Can you come on this side? It's too dark over there. And what I'm doing is I'm putting some pressure, and it kind of vibrates each one of the lumbar joints. And that allows it to break up any adhesions or scar tissue that's in there. Because we want to keep the joint nice and mobile, so it takes pressure off the disc and off the nerves. Okay, I get a lot of, I don't know what to say slack, but a lot of people tease me about this thing or say stuff about it because it does look like a car buffer, but what we're doing, it's just a industrial size massager, I guess you want to call it. Just loosening up his low back muscles, and we're trying to bring some blood to the surface. It kind of makes for an easier adjustment. Some of our patients come in with a lot of tension or tone. This makes the adjustment go easier. So once you lay on your side, face me. So now we're going to do a lumbar manipulation. I'm going to kind of put Jesse right where I need him. I'm going to bend that top leg. So we're going to adjust his low back or his lumbar spine, or decompress it. Nice and easy. Other side. You might hear a little bit of a pop there or crack, but that is just a joint decompressing. Good. Okay, come back up. We're going to sit on the edge here.
Yeah.
This next one here, I got to kind of scooch in, so maybe go over there. This is called an anterior adjustment. It's really good for these mid-thoracics. So cross one arm chin down. Then I'm laying back. Nice. Good. One more time. Good. How'd that feel?
Felt great.
All right, so what we did, we stretched them out, we adjusted them. Next, we're gonna do some electric stim on them, loosen them up a little more, then we'll put them on a roller bed, and then hopefully he'll feel good. He won't need to come back for a while. We try to get him where it's once every month, once every 6 weeks or so. All right, guys, thanks for watching. See you next time. Bye-bye.